Hello everyone, welcome to the program produced by Shandong Education Satellite TV on epidemics control and prevention. I am Zhang Haoran, the host of this program. Cleaning and disinfection during the epidemic is a normal and tedious work, especially in the indoor and outdoor campus. Different environmental disinfection are also different. What kinds of disinfectants are there? How to use them? What should be paid attention to after its usage? We will take you to answers one by one. Disinfectant is used to kill microorganisms on transmission medium to make it meet the requirements of disinfection or sterilization. According to the effective components, it can be divided into alcohol disinfectant, chlorine disinfectant, iodine disinfectant, peroxide disinfectant, phenol disinfectant, quaternary ammonium salt disinfectant, and guanidine disinfectant. According to the ability of killing microorganisms, it can be divided into high-level disinfectant, medium-level disinfectant, and low-level disinfectant. During the epidemic period, schools use disinfectants reasonably to cut off transmission channels and control the epidemic of infectious diseases. The most commonly used disinfectant is alcohol, which can be easily found in supermarkets and pharmacies. Alcohol disinfectant can be roughly divided into two kinds, 95% one and 75% one. Dr. Yan will explain to us what are the three main differences between these two. The first is the percentage. It contains either 75% or 95% of ethanol. The second is their sterilization ability. 75% alcohol has the strongest bactericidal ability, and 95% alcohol. Too high concentration will form a protective film on the surface of bacteria, which is difficult to kill bacteria completely. Then the third aspect is their usage. 75% alcohol is generally suitable for disinfection. 95% of alcohol is usually for cleaning. We usually use 75% alcohol to disinfect. After we spray it on our hands, what should we do to achieve better disinfection effect? Here is a demo from Dr. Yan. First, palms to palms. Second, fingers crossed. Third, rub the back of both of your hands. Fourth, rub fingers carefully one by one. Fifth, rub your fingertips on your thumb, both hands. Last step, rub your thumb, both hands. Then the whole process cannot be less than 15 seconds. For students that are allergic to alcohol, they can use hyperchlorite hand sanitizer, and it has the same disinfection effect. To disinfect at home, first we know 75% or 95%. Alcohol is alcohol, so we should keep away from inflammable substances. Do not immediately burn the gas stove, nor smoke right after spraying alcohol, and then do not spray in a closed space. During the epidemic period, the usage of alcohol is so common. We must learn to distinguish the usage of these two commonly used alcohol. 75% alcohol is medical alcohol, mainly used for disinfection and sterilization. 95% alcohol is mainly used for cleaning. When using them, keep away from fire source. Avoid spraying and disinfecting in closed space. Next, let's talk about the disinfectant commonly used at schools. Iodophor. After school PE classes, playing basketball or soccer will inevitably avoid scratches. At this time, iodophor played a key role. We use it a lot to wipe the wound. Dr. Yan will talk to us the principle of this disinfectant. Iodophor is actually an iodine-containing surfactant. Iodophor is less irritating than alcohol. It can kill most pathogenic bacteria, some molds, protozoa, and some viruses, and it has a good disinfection effort on vegetables and fruits, but it will damage the metal material, so it is not recommended to use it on the metal surface. In addition to the above-mentioned iodophor, which has a good effect on abrasions, the hydrogen peroxide solution is also an is also a disinfection that can inhibit bacteria. It is what we call peroxide disinfectant, which is commonly used in medicine. What's the difference between these two? Dr. Yan explained that hydrogen peroxide solution is usually used for polluted deep wounds and disinfection to prevent the formation of anaerobic bacteria. For example, if a student falls on the playground, the wound is deep and there is dirt on the wound, then we can use hydrogen peroxide solution. Iodophor is more commonly used for skin disinfection. The stimulation is relatively small. The common concentration of hydrogen peroxide is 3%. When it is used to wipe the wound surface, it feels like burning, and the surface will be oxidized to white with bubbles. Rinse with clean water could relieve the pain. Chlorine disinfectant, its main component is sodium hypochlorite. Its disinfection method is mainly applicable to the surface of objects. It is more commonly known as bleach or 84. When it comes to 84 disinfectant, before using it, there is a very important process, which is to dilute the solution. Take 84 with 5% concentration as an example. First, take 2 liters of water, then take 16 milliliters of 84, and add it into the water. Mix it properly and evenly, then soak it with a towel to wipe the table surface. 15 to 30 minutes later, wipe it with clean water. It is reminded that as a common chlorine-containing disinfectant, it cannot be mixed with other disinfection or cleaning supplies after configuration. In this way, it cannot enhance the efficacy, but also may cause serious toxic and side effects. Chlorine-containing disinfectants are irritating to the skin and the mucous membrane. When they are configured and used, masks and gloves should be used. Try not to use them when someone is around. Children should avoid touching them. In addition to the above 4 disinfectants, peracetic acid is used for general objective surface, anti-corrosion medical equipment, food utensils and tools, and air disinfection. Peracetic acid was widely used during the period of fighting against SARS, but what should be reminded is that peracetic acid is corrosive, and it is irritant to the eyes, mucous membrane, and skins. In addition to the above 4 disinfectants, peracetic acid is used for general objective surface, anti-corrosion medical equipment, food utensils and tools, and air disinfection. Peracetic acid was widely used during the period of fighting against SARS, but what should be reminded is that peracetic acid is corrosive, and it is irritant to the eyes, mucous membrane, and skin. If you accidentally touched it, rinse with plenty of water and see the doctor if necessary in time. It is important to wear protective equipment when using peracetic acid for disinfection, because peracetic acid is a peroxide disinfectant. Peroxide disinfectant will cause combustion and explosion in case of open fire. This requires each of us to have a full understanding of the use of disinfectants. Before use it, please read the instructions carefully, and please use it under the guidance of disease control institution and professionals. Preventative disinfection is important work. In order to ensure the life, safety, and health of our students and teachers, we should use disinfectants wisely. In addition to the above 4 disinfectants, peracetic acid is used for general objective surface, anti-corrosion medical equipment, food utensils and tools, and air disinfection. Peracetic acid was widely used during the period of fighting against SARS, but what should be reminded is that peracetic acid is corrosive, and it is irritant to the eyes, mucous membrane, and skin. If you accidentally touched it, rinse it with plenty of water, and see the doctor if necessary in time. It is important to wear protective equipment when using peracetic acid for disinfection, because peracetic acid is a peroxide disinfectant. Peroxide disinfectant will cause combustion and explosion in case of open fire. This requires each of us to have a full understanding of the use of disinfectants. Before use it, please read the instruction carefully, and please use it under the guidance of disease control institutions and professionals. Preventative disinfection is an important work. In order to ensure the life, safety, and health of our teachers and students, we should use disinfectants wisely. Here we have Chen Lu, the Deputy Chief Technician of the Environmental Health Monitoring and Evaluation Institute of Shandong Disease Control and Prevention Center. Chen Lu will talk to us disinfection at home. School use disinfectants every day, since it is a public place, and it is not necessary for us to do so daily at home. All disinfectants have some chemicals, which will cause certain harm to human body. For example, we often use alcohol disinfectant, also known as alcohol. If inhaled in large amount, it can cause neurotoxicity. The symptoms are also very familiar to us. It looks just like someone drinking too much. It has the same nerve excitement and the respiratory symptom. If it is serious, we need to go to the hospital to receive medical treatment. Also 84. If we inhale a large number of chlorine-containing disinfectants, it will stimulate the respiratory tract. It may cause dyspnea, cough, and chest tightness. If it is serious, it can cause chemical bronchitis, chemical pneumonia, or chemical pulmonary edema. If you are feeling cough and not breathing well, you can go to an open place and try to breathe in some fresh air. Of course, if your symptoms cannot be relieved or become more and more serious, you should go see a doctor in time and receive some corresponding treatment at the hospital. We know that school might open very soon. How do students disinfect themselves after they come back home from school? So when students get home, I prepare a bottle of hand sanitizer at the door and ask student to clean hands first. And then I ask him take off coat and shoes and put them all in proper place. And then put down all the things you wear and use outside, and then go wash your hands. So for leftover disinfectant in the container, it is safe that we dilute the unused disinfectant with a lot of water first and then pour them into the sink.